Okay, so I'm just going to get started. Assalamu alaikum, everyone. So my name is Hannah. I'm one of the directors at the Eritrean Canadian Cultural Center. So Jazakumullah khairan for joining us today. We're really happy today to be able to host such an event and bring everyone together for the purpose of learning and for the purpose of, participating in a give and take. That naturally is the core of any sort of thriving community that there is. So first and foremost, though, we'd like to first extend a warm welcome to our guests today, as we're happy to have two members of our community, and those are Dr. Khalifa and Dr. Safa Hamde, doctors that work in their respective fields, who today will, inshallah, provide us with their expertise regarding our health, and will also tell us how to navigate the wide spectrum of health during the holy month of Ramadan. Just before we get started, though, I'd like to just mention a few housekeeping rules. First of all, we just want to be clear that the conversations that we're going to have today with the doctors are meant to be broad, they're meant to be general, they may or may not apply to your situation, if at all. So just before, take it all with a grain of salt. If you make any decisions, make sure you do it with consultation with your specific doctor. This is not at all intended to replace any sort of medical advice. So just keep that in mind when you're listening in today. Secondly, feel free to ask any questions that you might have that might come up as the talk goes on. We'll have a Q&A session at the very end. And inshallah, as time permits, we'll be able to address those questions. But for the first part, we're just going to be listening in. So do drop your questions in the chat, and we'll have someone monitoring them throughout. And lastly, we just want to remind you to remain on mute during the talk so that we can get everything that we can out of it. And so first, I'd like to just start with introductions. I think I'll have the doctors introduce themselves individually. So maybe give us an idea of your background, your area of expertise, where you currently work, and if you would like any other sort of interests that you have. And we're going to start with Dr. Abu Bakr Khalifa, please.
Assalamu alaikum wa rahmatullah. First of all, thank you for having us. I'm really honored to be part of this group and have this conversation. So it's always hard to introduce yourself, but I'll try my best here. So my name is Abu Bakr Khalifa, Abu Bakr Jabir Khalifa. I'm an ICU physician out of the Hamilton, Toronto area, Burlington, to be more specific. I work in critical care medicine as well as internal medicine with an adjunct relationship with McMaster University as well. My particular focus is in technology innovation. So I do work in medical device and medical technology innovation to help healthcare, and also particular interest in newcomer health, where I work as an internal medicine physician in one of the newcomer clinics and out of the downtown Hamilton regions over the last few years. So thank you very much for having us, and looking forward to this discussion.
MashaAllah, thank you so much for that. And we'll pass it on to Dr. Safa Hamde, please. Ooh, you are muted. Let me unmute you.
Can you hear me now? Okay, good. Assalamu alaikum, everyone. Thank you for inviting me. It's an honor for me to be here. My name is Safa Hamde. I am a resident physician working out of Western Michigan University, currently in my first year of residency. I currently in Michigan, but originally from Toronto. Toronto will always be home for me. Interest, I try to help foreign medical graduates with giving them advices with regards to just applying to medical schools, and try to encourage a lot of them to go into the medical field. Interests include traveling, photography, things like that. I try to have a good balance between medicine and just living life, basically. Yeah.
Noted. MashaAllah, that's really good. I think balance is always key, right? So So I guess we'll jump right into it. We're going to get Dr. Abu Bakr Khalifa to start first, and then we'll move on to the talk with Dr. Safa Hamde. And like I said, just a reminder, if anything comes up, if anything crosses your mind during the talk, feel free to ask your question in the chat and we'll, inshallah, be able to address it at the very end, okay?
All right, thank you very much. Jazakumullah khair. First of all, alhamdulillah, hamdan kathiran tayyiban mubaraka. Salatu wassalamu ala rasulillah Muhammadin sallallahu alayhi wa sallam. Amma ba'd. This conversation and this discussion is meant to be helpful for our Muslim community so we all can learn together on what we can do to prepare for the beautiful, blessed month of Ramadan. May Allah subhanahu wa ta'ala make us from the people that attain that month. And the conversation, I'm going to talk about 2 to 3 points here to highlight how we can understand the concept of fasting within our lifestyle and making sure we have a healthy lifestyle during Ramadan. I think one of the key points that I want to start with is we always get asked the question, why do we fast? We always get asked the question, do you fast also from water? Is it 12 hours? This must be very difficult. And a lot of times we try to find reasons and explain, fasting by looking at the different wisdoms of fasting. And to start this conversation, I think it's very important to really focus on this fundamental concept. Although this is a health-related conversation around fasting, we have to ask ourselves and we have to be able to answer the question on why do we fast based on the fact that it is at the end of the day a commandment from Allah subhanahu wa ta'ala, and it has many wisdoms that yet for us to understand and learn and be able to benefit from. And this commandment is a gift from Allah subhanahu wa ta'ala to help us really become better Muslims. And from part of these wisdoms that come from fasting is the answer of it has some beneficial aspects to our health and our healthy lifestyle. So it's important to not undermine the whole commandment of fasting just to particular wisdoms around fasting and health in order to allow our audience, who are usually non-Muslim, asking us that question, and we narrow it down just to it allows me to have a healthy lifestyle, or it allows me to feel for the poor and needy. And yes, these are particular wisdoms, but it's important for us to really highlight how it's not necessarily a difficult task, but it is an honor for us to fast to be able to fulfill the commandment of Allah subhanahu wa ta'ala. And I think this is critical despite this being a health talk. So I will focus my next part around this and understand that what does fasting have in our body? What the impact does it have to our own body? And the impact that it has is when the human body, when humans actually are fasting, the human body goes into this mode of the starvation mode. And what that does is it allows our energy source in the liver, energy source in the fat, in order for it to break down. So instead of us using the carbohydrates we generally eat, we will be able to break down the stores in our body in the liver. It allows us to break down the energy stores in our body in the fat source that we have, and there is healthy and non-healthy fat. But overall, the body adjusts to a new mode of metabolism. The body starts to recognize that in this new mode of metabolism, you will be able to reduce your inflammatory response. So this is a very important principle, that fasting overall allows us to reduce our pro-inflammatory response. So the body has an immune system and has this immune system that is regulated by many factors. One of them is fasting. And what is very interesting is we generally, from the research and the scientific community, we are slowly understanding the benefits of fasting when it comes to heart disease, to diabetes, to obesity, to cancer, to Parkinson's, to epilepsy. So all these different disease facets, there's a lot of research being done to understand how does fasting in particularly impact these disease states. So the primary principles, and I believe Dr. Hamde is going to talk about diabetes, it has particular impact on our insulin sensitivity. So it makes our body sensitized to insulin in a much more regulated way. The other part is it reduces your inflammatory response. So we know it has particular focus on obesity and cholesterol. So people who are considered overweight or people who have cholesterol problems, diabetes help you regulate this. Fasting helps you regulate this. This doesn't mean that fasting is the cure and the treatment for all these disease processes. This means that fasting contributes to that. So I want to just focus on one research paper that many people in the scientific community are actually talking about. It was published in 2019 in one of the most prestigious medical publishing journals called the New England Journal of Medicine, where they did a major study on intermittent fasting. So all of a sudden, fasting, although it has started from a lot of religions, do have commandments of fasting, but now there's many people, whether they follow a particular religious belief or not, actually have fasting as part of their lifestyle in order to improve their overall health. So it's important to understand that this could be different than how we fast. So intermittent fasting, as an example, is a fasting method where people would fast for 16 to 18 hours from any carbohydrates, and they're able to drink water or coffee, but avoid any carbohydrates for 16 to 18 hours, and are able to not, for the 6 hours remaining, they will eat whatever they need to eat to meet their caloric intake. And that study that was published in 2019, it showed that it had major impact on health disease, particularly when it comes to losing weight. And obesity is very much linked to heart problems and strokes and diabetes. And it has particular impact on helping manage your diabetes. So there has been a major shift in the scientific community and a major focus, moving intermittent fasting from just a side recommendation for physicians, but is becoming more and more of a robust mechanism of treatment for patients. So it's important to recognize that when people talk about fasting in the general front, to understand what benefits it has. And I think this is one important principle to connect it to our beautiful and beloved religion, is that the fasting that is being studied that has the best impact is the fasting that is done constantly. So yes, Ramadan is 1 month of fasting that we do, but it is part of our sunnah, it is part of our teachings and our beautiful, blessed prophetic teachings to fast in a continuous manner, whether it's 1 day a week, twice a week. And this has major impact to our overall health, and at the same time allows us to get the pleasure of Allah subhanahu wa ta'ala, inshallah. And the last topic I want to talk about, and I'll hand it off to Dr. Hamde, inshallah, is a very practical tips on fasting, which is, what do we do for people who have particular disease? What are they supposed to do with their medication management? So I want to divide this into two particular groups. Group one are the individuals who have chronic diseases. So the chronic diseases are the diseases that once you're diagnosed, you generally have it for life, or you are always going to be on some form of medications to control it. Diabetes, high blood pressure, heart disease management, cholesterol management. So all these are the major, most common diseases that impacts our community and the overall society as a whole. A lot of the individuals in our community are going to have a medication regimen. Maybe it's 3 times a day, maybe it's twice a day. And it's very important for us to recognize that as individuals with chronic diseases, you should go to your family doctor or to your specialist and very clearly mention that you are going to be following and trying to follow the fasting month of Ramadan. And at that point, you can have a conversation. The first conversation is, should you fast or should you not fast? I'm not going to sit here and say whether you should or you shouldn't fast, because I think every case is very separate. But I think what's important is, for people who can fast, the physicians can adjust your medication. So if you take it 3 times a day, and that usually what works, maybe for Ramadan, they can adjust it to twice a day. Maybe for Ramadan, they're able to give you instead of taking 2 drugs, you can take 1 drug that lasts for 24 hours. Right? So it's very important for all of us. I know it's only 2 weeks for Ramadan, to whoever have these medical conditions, to call our specialists, try to get some form of appointment with them and say, can we adjust our medication? I don't want people to adjust it based on suhoor and iftar, right? Every drug makes a major difference. Parkinson's drug, very critical to take on time. Cholesterol medication, you might be able to work around fasting. So these are just important tips. The second segment I want to talk about are people who have acute illness. So people who are sick, needing, like they get an infection, they need to come to the hospital to get IV fluids. It's very important to recognize that if you are acutely ill and you fit in the category of people that that should not be fasting, follow your medical opinion, right? Follow the medical opinion of the doctors about fasting or not fasting in these conditions. But if you are taking antibiotics and you're getting better, and you wanna fast, this is again not a religious fiqh conversation, but I think it's important to tell your doctors that I generally fast so they can adjust your medications accordingly, right? And I want to end with this, being an ICU physician and seeing patients in acute illness. If you see a doctor, you come to the emergency room, and I know all of us want to be part of the month of Ramadan. If they say that, you know what, you need to get IV medications or you need to get antibiotics now, do not try to resist that so that to complete your fast. Allah subhanahu wa ta'ala has given us, there are many shuyukh and fuqaha who have given us different interpretations about when to fast and when not to fast. And it's important for us to understand the medical conditions that allow us to give us the gift or give us the permission to not fast so that we are able to get treatment for acute illness. So I'm going to end there. So Jazakumullah khair, and let Dr. Hamde, inshallah.
Jazakallah khairan, Dr. Khalifa. That was super helpful, I think, and I think we can take away quite a bit from that. Like he said, we'll pass it on to Dr. Hamde and see and move on to the next topic for now, inshallah.
Okay, inshallah. Thank you, Dr. Khalifa. Those were some great points. So inshallah, I'm gonna dive straight into the topic because I know time is limited. I chose to speak about diabetes and fasting because I think, given the fact that diabetes is very common, it's a common chronic condition in our community. I'm just going to highlight some key points about diabetes, and I hope, inshallah, you find it all beneficial. So diabetes, as some of you guys might know, is one of the most complicated chronic conditions that we treat in clinic. The reason being is that a lot of times diabetes is considered the silent killer, basically, because a lot of times individuals either don't know they have it, or they get diagnosed with it, but they don't see the long-term complication of it or the immediate implication of diabetes. So it's not taken very seriously. Diabetes can have a lot of complications. It can affect certain organs like your heart, your kidney, your vision, your nerves. So it's important to maintain your blood glucose and to keep a close eye and monitor it very closely. Just to kind of like touch on like the different types of diabetes. So there's type 1 and type 2. Type 1 is immune-mediated, and it's basically when your immune system attacks the cells in the pancreas that produce insulin. So type 1 is an early onset type. Your pancreas essentially does not produce insulin. And so your body does not uptake the glucose. And the management for that is simply just insulin injections. The second type is type 2 diabetes, which is a late onset. So you typically see that in older individuals in their like maybe 40s, 50s. However, now with the rise of diabetes, with the rise of obesity, you may see this in an early, like, in individuals that are younger than that. Also, with type 2 diabetes, it's essentially it's when your body is resistant to insulin. And a big part of that is lifestyle, diet, genetic plays a big part in that. In relation to fasting, like Dr. Khalifa has touched on, it's hard to give one advice to everyone because this is highly individualized and management is different from one person to another. So for that reason, I think I recommend that you consult your physicians, and like Dr. Khalifa has mentioned, you have to adjust the dose based on your lifestyle, based on your diet. And typically this is a shared decision between you and your physician. And it's important to understand that, like, I think it's important to know that what the symptoms are, what to look for, what the risks are, and make a sound decision based on that. You know, because the last thing you want is a hypoglycemic episode or hypoglycemic event when your blood glucose goes below a certain point, and that would require hospitalizations or other causes. There was a prospective study actually that I looked into for individuals that have either type 1 or type 2 diabetes. The episodes of hypoglycemia tend to be higher, especially during Ramadan. In type 1 diabetes, it's the increases by about sevenfolds. And individuals with type 2 diabetes, the risk increases to up to like 4-folds. So the main thing we try to avoid is hypoglycemic attacks. Let's see. And I think the typical range that you have to watch out for is if your blood glucose goes below 60, if your read shows below that your blood glucose hits below 60, you should end your fast immediately and try to consume either sugary drinks or food drinks to avoid hypoglycemic coma. And same thing goes if your blood sugar is higher than 300. I think those are the margins that you have to look for. If you do choose to fast, it's important to keep track of your glucose all the time. I know sometimes it might be a scary thing, but like I said, this is a shared decision, and you should consult your family doctor before you fast. Yeah, I think that's all for that. Jazakumullah khair.
Jazakallah khairan, Safa, Dr. Safa. That was really helpful. I think diabetes, like you said, it's definitely a very complicated condition, and it's something that a lot of people do deal with, and especially during Ramadan, I think it's something to consider. So those were quite a few things for us to think about when we're thinking about our individual cases, whatever they may be. Mm-hmm. For now, I think what we'll do is, if you have any questions that come up, just let us know in the chat if there's anything that comes to mind. I do have a couple questions that I was curious about myself for the doctors, so I'm going to ask away until someone stops me. So someone's going to have to stop me, so I'll keep going. So I'm going to start off with asking, because I know we touched on quite a bit about diet and the, with regards to our sugars, and we touched on things that are related to the number of hours that we fast and how that affects our levels, our cholesterol, and so on. What are some recommendations or things that you think we should take into account when we're managing the month of Ramadan and the demands that come with it with respect to our sleep hygiene, how well we stay hydrated, all of those things. I think, especially with the change that we experience when we're not really eating throughout the day, we're staying up late typically. So that's, what are some things that you would recommend? What's the importance of sleep hygiene, and what are some things for us to consider? And this is directed to either one of you, so go for it.
I guess I'll go ahead. I think two of the major complaints that people have in Ramadan is lack of sleep and overeating, or gaining weight, I guess. I think all of us, we try to make the best out of the month. So that's why sleep is the least of our priorities during this holy month. I would say it's very individualized with sleeping. The best form of sleep is uninterrupted sleep or continuous sleep, which is hard during Ramadan. So it depends if you're like a night owl or like if you're the type of person that sleeps during the day. So with work and trying to pray either Taraweeh or Tahajjud, it makes it difficult to have continuous sleep. So and everyone has like their own different schedules. So, but with that being said, I think trying to maintain a good amount of uninterrupted sleep is the best form. And also in terms of diet, trying to get a good balanced diet. I would say mostly try to eat food that keeps you filled for a longer time. Like for example, whole grain, like oatmeals, beans, diet that contains high fibers. I think those are the most important things. Try to stay away from complex carbohydrates, sugary stuff. Yeah, I think those are the main things.
Thank you, Dr. Hamde. I think there's not much I can add to that. I see a question here around the children and fasting, and how can we make it a safe practice from a health point of view. And I think one of the interesting research deficiencies in fasting is actually fasting in the very elderly and fasting in children. There's not a lot of research that's done in this area compared to fasting in the elderly individuals. So, when it comes from a medical research standpoint around what are the particular guidelines for fasting, you will find very limited resources available. And this is an area that, it's important when we say children, we're able to compartmentalize or at least segment what do we mean by children? If we're talking by individuals who are quite young, I think it becomes, part of the practice to, fast for a few hours and see how you do to make them feel of the month of Ramadan. But one of the important thing is for us is to understand that there's not a lot of research to back, children who are very, very young and the impact on fasting. One thing that we do know is that it is important for us if we if our children are ill, we should not be encouraging them to fast due to illness, if they have a particular illness, and to talk to the physician on board, especially if it's a chronic condition, to talk to the clinician. And you'll see a lot of children who have type 1 diabetes, for example, they usually have a very strong network of diabetic physician, endocrinologist, dietitian, and pharmacists who are very involved, because type 1 diabetics, as Dr. Hamde mentioned, they are in need of insulin. So how do you manage insulin when you're not eating, right? It's not a matter of like, I'm just going to take insulin at suhoor and I'll see what happens later on. It's very meticulous, and we have to be very careful. So when it comes to diabetes in children, which is the most common reason, which is the most common illness for young children in our communities, is we have to be able to really talk to our dietitians around how do we enhance the diet and how can we make a regimented fasting plan for them. And one thing I just want to highlight too, because Dr. Hamde mentioned the critical values of 60 and 300. For fellow Canadians here, is because the unit's a little different.
Sorry.
No, it's okay. It's okay. So I wanted to just highlight this point that 60 is around 3.5 or 4. So people who are measuring here is around 3.5 and 4, and 300 is around 16. And so for the fellow Americans, follow what Dr. Hamde is saying. For the fellow Canadians, inshallah, look at the numbers of 4 and 15 and 16 as markers to look into, inshallah.
Sorry, I've become too Americanized.
No, I just wanted no one to look at the 16 Canadian numbers and say, oh, it's all good. We'll wait.
Thank you for clarifying.
Jazakumullah khairan for that, and for that clarification. I do have another question that I'll ask away someone else to ask. I wanted to know, is there any particular advice that you would give to people who might be healthy and how to navigate having people that are ill around them that may be hospitalized?
This question is close and dear to my heart, especially working in a hospital setting. What we see in Ramadan, there's many Muslim patients in all our Toronto hospitals, and I'm just going to say Toronto area, but if you look generally throughout the hospital systems, there are many Muslims who are patients who are either in a very critical condition, or in ICU beds, or in post-surgical beds in the hospital. And I think it's one important habit that I would encourage all of us to start thinking about is when we look at our network and our families, we all want to go visit our families who are ill. And I think as a community, even if individuals, we might not know them, and many times in our masajid, they say that there's someone sick in this hospital, make dua for them. Try to do a little bit more. And this is the month of doing a little bit more. Try to ask what hospital they're at. Maybe if you know their family member, and you know who they are, without being imposing, going and visiting them if you can, and if this is something that is feasible and that's reasonable. The amount of stress and distress that many Muslims in hospital settings feel when there's a month of Ramadan, there's Taraweeh in the masajid, there's Tahajjud, there's Iftar, and they're not able to participate, and that puts a lot of psychological stress. And I think it's a duty for us as Muslims who are not sick to make it a habit of looking out for that. So instead of, the aunt or the mother or the father or to tell you that there's someone sick, we should try to have the initiative. And I'm gonna just share with everyone this hadith that we all have heard about. It's on the authority of Abu Huraira, may Allah be pleased with him, who said that the Messenger of Allah subhanahu wa ta'ala, and I'll say it in Arabic at first, and Abu Huraira radiallahu anhu, قال رسول الله صلى الله عليه وسلم إن الله عز وجل يقول يوم القيامة يا ابن آدم مرضت فلم تعدني قال يا رب كيف أعودك وأنت رب العالمين قال أما علمت أن عبدي فلانا and by name فلانا مرض فلم تعده أما علمت أنك لو عدته لوجدتني عنده ويكمل الحديث. And I'll say it in English for the English speakers here. Allah subhanahu wa ta'ala will say on the day of judgment, O son of Adam, I fell ill and you visited me not, or you did not visit me. He will say, O Lord, how should I visit you when you are the Lord of the Lords? He will say, did you not know that my servant, so-and-so, by name again, had fallen ill and you visited him not? Did you not know that had you visited him, you would have found me with him? So this hadith is not meant for Ramadan. This is meant for all the time. Now imagine the blessings of us as Muslims to think about being close to Allah subhanahu wa ta'ala by making this a habit, whether they're in hospital or whether they're at home, so that we get the opportunity and the blessings of this hadith. I say this part because this talk is about body, mind, and soul. And we have to be able to not just think about the medical conditions, but also think about how can we feed our own mind and soul to become healthy psychologically, and inshallah as better Muslims as well.
Jazakallah khairan for that, Dr. Khalifa. Dr. Hamde, did you have anything to add to that, or I don't want to cut you off?
I think Dr. Khalifa did a good job in covering the topic. Yeah, I don't have anything to add.
No worries at all. No worries. That's great. Okay. There is one question that is from the attendee that are asking, what's the best time to exercise during the month of fasting? So during fasting, during Ramadan.
I'll go ahead and answer that. And this is purely based on experience, nothing clinical. I think the best time to exercise would be not right after breaking your iftar, but I would say a couple of hours after, just so your body had enough time to kind of like use the food as energy, basically. This is not based on clinical experience, clinical reasoning or anything like that, just based on solely based on experience. A lot of people, depending on your preference as well, some people choose to also exercise before suhoor. Some people are able to do it during fasting, but I would highly discourage that because I don't know, everyone's different. You might, I'll just leave it at that.
No, it's a good point you mentioned there because, especially dehydration, you mentioned as well, the hypoglycemia could be a concern for people especially there's many people who have like organized sports right before iftar. So be careful because there's many people in our community who have particular illnesses. So when you organize sports like that, you might be inadvertently, without knowing, actually not allowing some groups to be part of that. Because that could impact their health. So I think that's absolutely. And there's not a lot of research in this area, right? Like there's just not a lot of research on, but it's growing. And I think it's important for us with time, as more and more research institutes are focused on this, we're going to be able to have better and better answers, inshallah.
Inshallah. I'll just add this: if you do choose to exercise, I would say try to stay very well hydrated, especially if you participate in sports. Hydration is a big thing. So yeah.
I see a question here around best form of eating during Ramadan. I think it's linked to the exercise. So a heavy portion after Maghrib or after Taraweeh. I think no heavy portion before, after Taraweeh or after Maghrib. So we try to focus on having very balanced diet for multiple reasons. Number one, from a health perspective, when the body gets the stress of not eating, and all of a sudden you're throwing all these carbohydrates on the body with the sambusa and the fatair and all of that, all of these are very heavy carbohydrates. So what it does is all the benefit you got from fasting, it causes a major spike in your insulin levels. So with that spike in the insulin levels, your body is going to go back into stress mode of, now I went into the hibernating fasting mode, and all of a sudden I'm in stress mode. So those shifts biochemically is not going to be helpful for us.
So balanced diet, no heavy meals, right? That's what we're getting.
No heavy meals, no heavy meals, small diet, and it will help you concentrate in Taraweeh as well.
Yeah, noted, very noted. Yes. So there will be a couple unhappy people out here for sure. We have another question that asks, should we change our working hours during Ramadan to make it easier to fast?
If you have the luxury of doing that. Sure.
Yeah, if only.
Yeah, I don't have an answer for that.
Me neither. I think you said it correctly. If you have the luxury to do that, then that would be amazing.
Yeah.
But a lot of us don't. So whatever we can, inshallah.
Absolutely. Yeah, and I think there was mention earlier about not just diet, but there was mention about the types of food that we should be eating and the things that we should take into consideration when it comes to our cholesterol, our sugars, and so on and so forth. Would you say that that's something that we should consider, or is there anything that we can do to prep prior to the month of Ramadan starting? Do you have any recommendations as to maybe if there's like steps that we can take to prepare for the month coming up when it comes to, whether it's making certain visits to doctors, creating a plan, whatever the case may be?
On that note, when it comes to a lot of the research that's done on diet is for fasting is centered around diabetes. So to highlight that point, the Canadian diabetes. So if you Google Canadian diabetes or Diabetes Canada, and look at Diabetes Canada patient resources, right? I think it's important to highlight this because this is where you'll find all your specific questions answered and allows you to calculate how should I organize my diet, what are the different tips from the guidelines, because it's going to be very difficult to summarize all of this in this talk. But if you go to Diabetes Canada and look at the patient resources, there's very good tools and resources there to help you. I'll put the link on the chat as well for people to save, to help you, understand what is the best dietary plan. So I would say that a lot of the best research done on diet and fasting, particularly there are sections on Muslim way of fasting, which is the way we fast, because remember, you have to really look at the resources you read. Some people or there's a lot of resources on intermittent fasting. It's not necessarily how we fast. So it's very important for us to really differentiate the different type of fasting when looking at these type of.
There's a question in Arabic here.
Yeah, you can go ahead.
I'll attempt to read it. Okay. ما هي الخطوات التي يجب اتباعها من مريض السكري للنوع الثاني للصيام بأمان? Translation. What are the steps that we need to that someone needs to follow if you have type 2 diabetes, right? Okay. The steps to follow. It's very difficult to give you an advice. I think you have to consult your physician so you can adjust the dose of the medication depending on how how your body metabolizes. So it's very difficult to give you a specific answer. But I would say if you are the type of person that I guess one of my recommendation would be to just monitor your blood glucose very frequently, especially if you have just started fasting. I think keeping a glucometer all the time to maintain your blood sugar at a certain level, and try to, like I said before, try to maybe avoid the keeping your numbers in a certain range. And again, if you feel like you're having some symptoms like dizziness, sweating, things like that, you should immediately stop fasting, try to consume some sugary drink or something like that to avoid it. Yeah, I think that's all I have. I don't know if Dr. Khalifa wants to elaborate on this more.
No, this is great. The only thing I just add to this is, I can't reiterate what you said about frequent glucose checks. And if you feel like your glucose is reaching a level that is low, right, more than once, twice, and you're feeling unwell. So hypoglycemia is the sugars are low, but then you feel like you're dizzy, you're lightheaded, right? There's no question that the instructions at that point is to make sure you take some sort of meal, so that, and sugary meal. Don't take a Diet Coke or a Coke Zero. Sugary meal so that you increase your sugar levels. I think that's essential. The important thing is a lot of our patients are actually eligible for the Freestyle Libre. If whoever doesn't have it, or doesn't know what it is for diabetes, there's this sensor you put on your skin that can last 2 weeks and can be an easier way to check your sugar levels. So if it's Ramadan, it might be hard for you to check your sugar levels all the time. So the Freestyle Libre is going to be attached to your skin, and you can just use your phone to measure it. So many people who have diabetes and have it are probably nodding their head right now. So I would encourage, and it's covered for people who have diabetes. So for the majority of patients who have diabetes, there are exceptions. So it's covered under OHIP. So my recommendation is to make sure you talk to your physician about that as an option, so that it can facilitate and make it easier for you to do your sugar checks. That's just one addition to your answer.
That's great, thank you. We'll probably do, in the interest of time, we might do 1 or 2 more questions. But we have one here where it asks, why do most people tend to put on weight during Ramadan, although we go without food for long hours?
My computer froze. My computer froze right when you said that. Why do most people tend to put on weight? Big meals, full carbs, and causing your insulin to just keep spiking, right? So that's what keeps happening. Remember, we said initially that when you fast, you use your fat cells, you break down your fat cells, you break down your liver stores. So if you do it consistently and you eat in a healthy way without having major meals, you will lose weight in a healthy way. It will happen. Our problem is when you really measure how much carbs is in a plate full of carbohydrate iftar that we have, right? It's going to be, I promise you, more than 1,000 calories. When you have 2 or 3 of that, you've hit 4,000 calories in 6 hours. So now you went from having 3,000 calories in 24 hours, you're having now 3,000 calories or 2,000 calories in 4 hours. So the body is just going to go up, and your insulin resistance is going to be completely affected by that.
I'll just add one point. I think a lot of us are guilty of this too. We eat a very large amount before going to sleep, and that's the worst thing you could do. So try to eat a diet that is balanced and foods that will keep you filled for a longer times, like high fiber diet, whole grains, beans, things like that are important.
Okay. So no fatty foods is what I'm hearing, right? Okay, noted. All right, so I think we've covered quite a bit regarding nutrition and diet. That seems to be the core of our conversation today, and I think we've also talked quite a bit on diabetes, which makes a lot of sense that we would. Would you have anything to say about? Because I think we touched on people that are hospitalized and people that might have an illness. I think Dr. Khalifa, you talked about, ensuring that you still kind of consider taking antibiotics, whether it's for a short-term illness. But is there anything that you would say about managing, or would add about managing short-term illnesses? And because I think sometimes what ends up happening is, I don't want to say that we tend to overlook it, but there's something about us overlooking illnesses that can turn into something more serious that seem small or minor at the time. So is there anything that you would say about how to consider that, what sort of steps to take when we're assessing or knowing what to do about it during the month of Ramadan?
Dr. Hamde, feel free to take it first if you like.
Okay, it's all yours.
Yeah, no, it's take your antibiotics. Like that's number one, right? And take your antibiotics and finish your course. The biggest thing, Ramadan or not Ramadan, is people are told take 7 days of antibiotics. They take 3 days. They feel so much better. They feel like they're 100%. And you take your 4 days of antibiotic and you put it in your cupboard, and you come at the end of the year, you'll find 4 boxes of antibiotics unfinished, right? So the number one message to acute illness, usually it's infection. And if it's an infection and they give you a course of antibiotics, please complete your antibiotics. Something on this as well is that if you don't take your full course of antibiotics, you're treating the infection to a certain degree. You might control it, but the infection gets smarter, the bacteria gets smarter. That next 6 months you get another infection, you weren't able to fully eradicate it, so they get resistance. And when they get resistance, this antibiotic that should solve this infection is no more going to be effective. So you put yourself at a position, if you keep doing that for 5-10 years, when someone gets ill with a major infection, now you don't have really good antibiotics to fix your problem, right? So we have to really take into account, because you develop resistance to the common antibiotics, and it makes it very much harder to treat your infection. So it's very important to take your antibiotics, but it's important to tell your doctor, if I am ill, maybe I shouldn't be fasting for the next few days, but if I have 2 more days of treatment, can I fast? And if the doctor says, yes, you can fast, make sure you tell them, I am fasting from this hour to this hour. You cannot assume all the doctors are going to know how you're fasting. So I'm fasting from this hour to this hour. Can I adjust my medication accordingly? Right. So that would be my recommendation on that.
I'll just add quickly, please do not take your antibiotic for common colds or flu, things like that, because you will build resistance. And like Dr. Khalifa said, you will need stronger antibiotics that will do more damage to your body, actually.
Yeah, no, absolutely. When it comes to antibiotic, talk to your doctor and ask, right? We come from a culture of, when we get ill, we want to get to antibiotics, right? That's what we come from, that culture, and we get sometimes frustrated, to Dr. Hamde's point, when they say it's a common flu, you're probably not going to need antibiotics, and you feel very sick, and you're like, man, how can you just give me Tylenol, right? Like I need antibiotics. And the reality is, by you following these instructions, and if it's a virus, you're probably going to get better. It's not going to feel good for 3-4 days, but you resolve the resistance problem. So I just had to emphasize that point, because it's very, very common issue in all patients, let alone our community.
Thank you so much for that. I think that that's really important, and that's a really important takeaway for us, especially to end on. I think for now, our time is coming close to an end. So if there were any sort of questions that you had in mind that we didn't get to answer, then inshallah, this is just the start of what we intend to do in the future. And inshallah, we'll be able to cater more to what the community's needs are at the time. And we'll have more of these sessions moving forward. So on behalf of ECCC, I'd like to thank our speakers, Dr. Hamde and Dr. Khalifa, for taking the time out of their day and their evening and speaking to us about these important topics. We'd also like to thank our attendees for your participation and for your continued engagement in our endeavors as part of ECCC, and we look forward to seeing you at our next talk. Our next talk as part of this series will be taking place, just so you're aware, on March 18th at 2 p.m. Eastern Standard Time with Sheikh Hashim Basurra. Inshallah, so if you want more information, then do reach out. It'll also be on Zoom. So that's it for me, and Jazakumullah khairan, everyone, and Assalamu alaikum wa rahmatullahi wa barakatuh.
I think there's 2 people that have their hands up.
Assalamu alaikum, sorry.
Not so bad.
Assalamu alaikum all. Yeah, thank you very much, Dr. Abu Bakr Khalifa and Safa Hamde. MashaAllah wa tabarakallah. We are very, very proud, excellent by you to present this kind of information. It is amazing with 47 or 48 participants. This is great. My question is to Dr. Abu Bakr. You mentioned 2019 study was done about, major study was conducted about how to adjust the medication, something like that. We have to adjust our medication. What is the study that conducted 2019? If a patient, for example, is that if a patient is taking 3 tablets, for example, 3 times a day. So when you say adjust, the doctor will make it instead of 3 days, 2 days. Is that what you are saying? And for Dr. Safa Hamde, my question, it was very, very interesting. You mentioned diabetic is a silent killer. It is true. You don't know silent killer, type 1, type 2. Type 1 is for children. Type 2, you said if it is very, very serious during Ramadan, the hypoglycemia will get high, and this one can lead to coma people suddenly can die. Is that really very, very scary and very interesting, mashallah wa tabarakallah. Just I wanted some clarification on this one. The hypoglycemia will be very high during Ramadan. So if the people, they don't go to doctor, it will end up going to coma, or, diabetic is very, as you mentioned, silent killer. It is very difficult, really. So we are pushing our people to go to doctor. Is there any information? I mean, for that one, how can we approach for that? They have to contact the doctor.
Yeah, no,
thank
you. Jazakallah khair, Sister Salma. Thank you very much. I'll do clarifications from my end. When it comes to research, the 2019 research paper, it wasn't on medication, it was on intermittent fasting. So I just intermittent fasting and the impact of intermittent fasting. So it's written in the medical journal for medical professionals to read it and understand it, but it's also important for the public to read it. So I just clicked I put a link on the chat to review, what they've looked at in intermittent fasting, to give you an idea of how you can maybe some of the ways that they have done the fasting and gain the benefits. How do we try to bring it to our Ramadan fasting, and maybe we're able to get similar benefits as well. So that's one point. The second point was around the 3 days medications. There are many times that the medication regimen you're on, you have to be on it. It cannot be changed. Right? So that's why you got to go talk to your doctor. A good example of that is people with Parkinson's disease. Parkinson's disease is a neurological disease that needs medication to regulate your neuromuscular and your muscular movement. You cannot, it's very difficult to adjust those medications, right? So you don't have symptoms. So for these medications, a lot of times you cannot adjust it, but you have to talk to your medical specialist. But for other medications, if you take twice a day, there might be an opportunity that you can, instead of twice a day, actually do it once a day. But not based on your assessment, not based on, I'm just going to take once. You got to go talk to your doctor, and they can adjust your dosing, and they can adjust. There are longer term drugs that can be given once a day instead of twice a day. So this is where I said, it's very important to go to all of us to be very deliberate with our specialists. We fast from this time to this time. This is the month we fast. How can I adjust my medications?
Okay.
That answers the question.
Excellent. Thank you. Jazakallah khair, Dr. Abu Bakr.
Jazakallah khair, Salma, for asking these questions. I just wanted to clarify some points. The reason why I said it was a silent killer is because people sometimes either have it and they don't know they have it, or they are diagnosed with it, but they don't take it too seriously, and or because they don't see the complication, or they don't understand the complication of like a long-term of uncontrolled diabetes, and or they don't see the immediate implication of it. So that's one of the reasons why a lot of people refer to it as a silent killer. The second thing you said about hypoglycemia, just to clarify or define it, hypoglycemia basically means when your blood sugar is below a certain threshold. So when it's below 60, that's considered hypoglycemia. So this is when you kind of bottom down basically. And you want to always avoid that, because that will lead to hospitalization and more complications. So that's what hypoglycemia is referred to. And you typically see that more, you can actually see it both type 1 and type 2 diabetes, but you see more, I would say, type 1 diabetes. A lot of times it's just important to control your sugar and keep your sugar within a certain threshold, so you don't go too low, basically.
Thank you.
I hope that's clear.
Yeah, very clear. Thank you very much. Jazakumullahu alf khair. Barakallah fikum.
You're welcome.
Okay, so we have one more question from Marwan, so we might as well answer that.
Assalamu alaikum, everyone. Thanks for hosting the session today, and I was glad to listen in on this really important conversation. Dr. Abu Bakr Khalifa, Dr. Hamde, thank you so much for kind of taking the lead here and giving us some of your, advice and expertise. I think it's much needed because of how prevalent I think diabetes is in our community. And I think we all know somebody or some people in our family or close to us who are suffering from this. And especially during Ramadan, it's an important time to kind of, take heed of what that means and to make sure people are staying safe while they're fasting. So more of just a comment. I just wanted to say this is a great presentation overall. And thanks obviously to ECCC for hosting this event. It's incredible. And hopefully we can have more conversations like this in the future too, because it doesn't just apply to Ramadan. This is an issue I think that is affects people year round, as we know. So inshallah, looking forward to another event with you guys. Thanks so much.
Jazakallah khairan for that, Marwan. We have another question from Abdullah Hashim. Abdullah Hashim, your hand is raised. Did you want to ask a question, make a comment?
Okay, Dr. Khalifa and Dr. Hamde, thank you so much for your precious time. For someone who takes B12 injection to boost the RBC, if that's to be skipped during Ramadan, will that have any impact?
Okay. Here's what I'm gonna say. In B12 injections and medications like that, you should talk to your family doctor about considering adjustment, right? Whether you need an injection or you can take oral pills, or you could do it while you're not fasting during the times of not fasting. Have a conversation with your doctor. There are times where you should not be doing that. You should not be stopping it, and there are times that I wouldn't recommend stopping it without talking to your doctor. That's number one. What I would recommend is talk to your doctor to see if there's alternatives on when to take it, right? Thank
you.
Okay. Jazakumullah khairan, everyone. I think that's it for tonight. Thank you again to our speakers, like I said earlier, and to our attendees. And we look forward to seeing you soon, inshallah, at our next event next week, inshallah.
Thank you very much. We really appreciate. We need this kind of information and education. Jazakumullahu khair. Thank you so much. Ramadan Kareem, barakallah fikum. Thank you.
Thank you. Thanks, Dr. Hamdi. It's a pleasure.
Thank you.
Thank you, Dr. Khalifa. Ramadan Kareem, everyone.
Thank you. We really appreciate it. Dr. Abu Bakr and Dr. Safa Hamde. I really, really appreciate it. It was very nice talking to you guys. My name is Hussein. Ramadan Mubarak. Thank you.
Ramadan Mubarak. Barakallah.
Assalamu alaikum.
Wa alaikum assalam. Thank you very much.
شكرا دكتور أبو بكر. شكرا دكتورة صفاء.
عفوا.
Thank you.
Thank you. Have a good evening. Assalamu alaikum wa rahmatullahi wa barakatuh.